No clue. It's so
Maybe
strange.
that allows you to webinar stuff.
All right, so we're live now. Okay, let me get my presentation going. And then I will now share my screen. Okay, so can everyone see this all right? Okay, so good morning, everybody. And thank you for joining us today for UConn's first inaugural Human Rights Symposium. I am thrilled to be here today with some very intelligent and respected women to discuss important themes that surround the vast topic of immigration. Today, we will discuss 4 particular themes that are listed on the screen and connect them in ways that many do not always think about. If you come up with any questions at all for our panelists, please send them via the Q&A section so we can ask our panelists towards the end of the discussion. I would like to start off by introducing our first panelist, Dr. Ann Gebelein. Dr. Gebelein received her doctorate and master's from Yale University. And prior to her work here at UConn, she has worked as an educational consultant for the Anti-Defamation League and the Coordinating Council for Children in Crises, as well as a translator in healthcare and law enforcement settings. Anne now teaches a wide array of courses in Latino and Latin American studies, one of which she leads with our next panelist, Grace. Anne is also a director for El Instituto. Welcome, Anne.
Thank you.
Our second panelist is Grace Lemire. She's a senior here at UConn, double majoring in urban and community studies and human rights, as well as minoring in social justice organizing. For her capstone course, she decided to work alongside Anne to co-facilitate a course entitled Organizing for Immigrant Justice. She did this in order to have the hope that making social justice more accessible to her peers. So we're very happy to have you here today, Grace. Next up, our third panelist for today is Katia Daley. She not only is a former Husky, but she's also currently serving as the healthcare campaign organizer for Connecticut Students for a Dream, an organization dedicated to fighting for the rights of undocumented youth and their families. Katia also leads the Husky for Immigration Coalition, which the main goal is to fight for policies to expand healthcare access for all immigrants, regardless of status, and open eligibility to the Husky Health Program. So thank you for joining us here today, Katia. So today, our first theme that we want to discuss is labor rights. Now, so this question I want to aim more towards Anne, if you could please expand on how pivotal immigrants are to the American economy, for example, frontline workers, and what does it really mean to be a worker but who is also undocumented, and how would you say that the two identities intersect?
So one of the things that I've been looking at quite a bit lately is undocumented work in times of crisis. And part of that was inspired by a class that I have with Diana called Human Rights on the US-Mexico Border, Narratives of the Immigrant Experience. And we read a fabulous book, The Undocumented Americans by Carla Cornejo, and we were actually able to speak to her. She was an invited guest at El Instituto, Yale doctoral candidate, undocumented Ecuadorian descent. And she mentions in her book, she actually has conversations with undocumented workers who were present at 9/11 and worked at the cleanup site. So one of the things that we've been talking about in class is the many ways in which undocumented peoples are essential, but also often unappreciated. And in another class I teach this semester, also with Diana, co-led by Grace, we've also looked a lot at the issue of wage theft in Connecticut and how wage theft in Connecticut impacts the undocumented community. And we had invited Heather Callahan, who works for the Federal Department of Labor, and who for 19 years investigated accusations of wage theft in Connecticut and Rhode Island. I'd like to first walk you through what different studies, when taken together, tell us about the incredible essential nature of undocumented people working in disaster relief, really, but then also focus back on what's happening right here in Connecticut. So, well, and actually, I should back up just one more step and explain to folks where undocumented workers are in general in the United States in terms of where the occupations that they're in. So undocumented workers are 4.4% of the workforce in the United States. That may not sound like a lot, 4% out of 100%, right? But they're overrepresented in many occupations. Not hard to imagine, really. So there are 7 million people working in the United States without documentation, if that's the estimate. And 5 million of those would be considered essential workers. So 5 out of 7 essential workers, million is a lot. And of those workers, they estimate that about 500,000 are in healthcare, including 15,000 registered nurses. A lot of these folks that we have close tabs on have DACA. And so if you have DACA, you are paying the government $500 every other year to report to them your activities. So that's one of the ways we can get that data. But if you think about how many people are probably taking care of elderly in their own homes, I think that those numbers would probably exceed the 7 million workers, quite frankly. But what we base data on what we can realistically measure. And so 1.7 million undocumented workers are involved in the national food supply chain. 15% of them, they represent 15% of all construction workers, cleaning and maintenance workers. They're overrepresented in waste management. They are 1 in 5 landscapers, 1 in 5 housekeepers. They're 25% of all fishing and forestry workers. They are over 1/3 of poultry workers and drywall workers. They are about half of agricultural workers, just under half. And part of the reason they've gone from something like 53% of all agricultural workers to more like 47% of all agricultural workers is because tighter borders have meant that more farm owners have invested in H-2A workers. So the H-2A worker numbers are increasing, and that's actually bringing down the relative percentage of undocumented agricultural workers. But 48%, you can basically look at 50% of the fresh food and vegetables in your refrigerator and say 50% of the food in my refrigerator has been planted, tended to, harvested, packaged, delivered to me by undocumented labor. So if you like fresh fruits and vegetables, if you like meat, right, because they're overrepresented in slaughterhouses, and again, poultry workers, they are in factories processing toilet paper in Wisconsin. If you like toilet paper, if you use toilet paper, they're responsible for just about everything. And I think the industry in which they're most overrepresented right now is in dairy workers. So they did a recent survey, Milk to New York, in which they surveyed the dairy workers, which are in northern New York. And of the people they surveyed, 83% of dairy workers in New York were undocumented. at least 1 out of every 3 Vermont dairy workers is a Mexican. And when they surveyed, I mean, estimates actually range as high as 90% undocumented for New York dairy. Everybody I speak to in Vermont who works with dairy say that pretty much everybody's undocumented that they've met in farms. So if you like yogurt, if you like ice cream, if you like milk, you can thank an undocumented person in this area because you wouldn't have milk or dairy without them. And another thing they found in the survey of upstate New York workers, that 80% of them reported depression. Mental health is something terribly understudied in the Latino population in general, but with undocumented people, it's at crisis levels, and it's something that's not on people's radar screen. 28% of them reported wage theft. Most of them reported substandard housing conditions. And these are Mexicans, Guatemalans, and Hondurans that are largely responsible for us getting milk and yogurt and ice cream into our houses. So you can see how they're essential. Obviously, with if they're registered nurses, clearly, if they're working in COVID wards, but also in terms of our national food supply chain, they're absolutely essential. We would not have fresh food and vegetables and dairy without undocumented workers in the country, and that's reality. So I'd actually like to shift now and talk about undocumented workers cleaning up crisis areas, and then I'd like to end with thinking about the wage theft conversations we've had in Connecticut for this section. So, Carla Cornejo in her book, it draws attention to what were 6,000 undocumented workers that helped with a cleanup of 9/11 in New York City. And of those 6,000 people, only 2,000 of them have actually tapped into the federal fund for healthcare support for people that got sick working on that site. We now know just how toxic that site was. We are now tracking 20 years out just how many people got cancer, how many people that survived that cancer or survived that experience have breathing difficulties, have long-term problems with reduced lung capacity, asthma, emphysema. And many of the people who do not try to access those funds to pay for their health care are folks that are afraid that this is a federal fund and that their information is going to be delivered to the federal government. And under Trump, a lot of people felt very uncomfortable about giving their names to the federal government. So 6,000 people is really a remarkable number. A total of 20,000 people have qualified for that fund, and many of them were actually first responders, not what we call second responders, people that actually worked in the cleanup itself. One of the really saddest parts of Carla's narration is that onlookers, when they realized just how many of them were Latino, started jeering at them and cleaning up the site. This also happened in Hurricane Katrina. Even the mayor himself complained about the Mexican invasion into New Orleans. And of course, no one back then realized just how essential a service they were providing in their words, wanting to get New York economy back up and running and wanting to get New York back to the great city that it was. So I started looking into, because I knew that they had helped a lot in Hurricane Katrina, and in fact, Honduras has a special connection to New Orleans, and I knew that there were a lot of Hondurans that had come up in Hurricane Katrina to help out, both from Honduras, the country, but also Honduran Americans. It just came across the country because New Orleans is a special place for them. So in terms of the Latinos that cleaned up Hurricane Katrina, they are from Mexico, they're from Honduras, they're Nicaraguan, and they're Salvadoran. Primarily, 1 in 4 workers cleaning up Katrina were Latino. Of those, 54% of them were undocumented. And a group of labor lawyers at Berkeley started to interview folks in New Orleans about their experiences in cleaning up Hurricane Katrina, and they went there when the cleanup was happening. And what they learned was that 250,000 structures were damaged or destroyed. So there was a lot of work to do, both if you have 250,000 houses and buildings that are damaged or destroyed, that's a lot of cleanup. Undocumented workers were paid $10 an hour for this. If you were documented, you were paid $16.50 an hour. Many workers that were housed on site to help with the cleanup were in sites that had no running water because the city was in shutdown, right? There was all kinds of problems with infrastructure damage. So people had no access to showers that were trying to clean up literally dead bodies floating inside of houses and in streets and canals. Both in 9/11 and in Hurricane Katrina, people were not given proper equipment. They weren't given proper respirators. They weren't given proper suits and ways to protect themselves. They weren't given healthcare coverage or assistance when they got sick. They were not trained in how to clean mold, toxic mold from schools and from hospitals to get them up and running again. And this pattern, actually, of undocumented workers cleaning up really horrendous, dangerous sites repeats itself both in Hurricane Sandy, where they're tasked to clean up the New Jersey and the New York shoreline, and also in Texas in Hurricane Harvey in 2017. And in 2017, again, there are people on the ground. The Fe y Justicia Worker Center is interviewing folks in Hurricane Harvey, finding that wage theft is rampant. 26% of undocumented workers reported within the first 4 weeks of cleaning up Hurricane Harvey that they had been cheated out of their wages. 34% were ultimately injured. 67% acknowledged that the workplace was unsafe. Again, most were not given training. They weren't told about the risks of mold removal. They weren't given protective gear. Hurricane Sandy works a little bit differently because people learned from 9/11. And so Hurricane Sandy, they actually do it a little better. El Centro del Migrante and Bay Parkway Community Job Center work to actually insist that jobs be funneled through them. They have people who need cleanup sign contracts agreeing to pay workers a minimum. And El Centro del Migrante does file a lot of labor complaints when, again, wage theft begins to happen. Make the Road New York also helps with that effort. But just the El Centro del Migrante manages to log in 361 different jobs in 2012 that undocumented peoples were asked to help with. So when we think about what is an essential worker, what is more essential than this, right? Cleaning up toxic natural disasters, which thanks to climate change are not going away. We are going to continue to need people willing to get knee deep, quite literally, in floodwaters and in toxic sites to help America be safe in some of our most important cities like New York and Houston and Miami and New Orleans. So to think that they were also paid less, not deemed worthy of protective gear, not deemed worthy of training, is actually part of how we perceive undocumented workers. And so we're going to get to narrative change, right, by the end of this presentation. But I'll say that one of the challenges to workers getting their rights is that there are often official policy decisions to suspend labor and occupational safety standards enforcement in disaster zones. So part of that is because there is no way to secure a job site as safe if you are literally in 250,000 house damaged zone where there are literally dead bodies in those houses and in the streets and dead animals, and there's mold everywhere and damage from floodwaters, you can't guarantee a safe work environment. So those standards are relaxed. What is also relaxed is who you can hire and the kind of documentation you need to hire them, which is often how a lot of undocumented workers can get signed on relatively easily. But it also means employers have very limited legal incentives to provide training and equipment, right? Because all these OSHA standards have been relaxed for them because it's a disaster zone. So it's one of the many ways in which undocumented workers are vulnerable in the United States and incredibly essential. So we think about a pandemic as having essential workers, but what about 9/11, right? What about Katrina and Harvey? So I'll now close by sharing what some of Heather Callahan shared with us about what's happening in Connecticut, which is that the Department of Labor gets about 300 complaints of wage theft every year between Connecticut and Rhode Island. And in 20 years, Heather said, those numbers have not changed. They've been constant. And the Department of Labor knows that if there's 300 folks willing to come forward, there are probably more than double that who are not willing to come forward. We also work with an immigrant rights organization in Hartford. We've been partnering with them, and they said that wage theft is the #1 issue in Connecticut for undocumented workers, that and immigrants, legal workers as well. So immigrant workers in general, that their #1 issue is wage theft in Connecticut, and that their second most prevalent issue on the job is sexual harassment, which is also rampant in Connecticut. And if anyone's curious, I certainly have anecdotes, and so do, and there are also some posted on the Department of Labor's website about some of the cases that have been brought against Connecticut and Rhode Island workplaces. How's that for a long answer?
Thank you, Anne. I mean, you really discussed a lot of the different themes that tie into healthcare, into labor rights, and how they actually end up tying into healthcare as well, which is something that we're going to have Katia Daley speak on. So for our next question, Katia, as a lead for Husky for Immigrants, could you explain what healthcare policies in the US look like for undocumented Americans, and what kinds of healthcare policies in the US account for the lack of protections in healthcare for immigrants?
Yeah. So right now in the United States and in Connecticut, undocumented folks are unable to get access to healthcare through the Medicaid or the Medicare programs that are like state and federal funded. So that's a barrier to healthcare. And as we know, the private industries that for the insurance companies and healthcare system here in the United States is quite high. So the idea of having them get their own private insurance is non-existent. So at this point, there's no protections other than the emergency Medicaid funds that some people, some undocumented folks use when there has been an accident, or their preventative chronic illnesses that were unattended get to a point where they're unable to be solved by themselves or with natural medicines, and then they have to go to the hospital or the doctor, and those are more severe cases, right? Because there was no preventative care, they are unable to have those things checked on even before it got worse. So the system in which undocumented folks get healthcare is it's non-existent in some cases. There we are, as Anne was saying, there's a lot of things that we do for the community here in Connecticut and and nationally, but unfortunately we are left out of most of the resources that we need to, have a dignified life. I think one of so us with Connecticut Students for a Dream, we have been pushing for a piece of legislation, SB 956, which will expand access to the Medicaid program Husky of to undocumented folks, regardless of status. So these Ps basically will give access to the Medicaid program from Husky A to Husky D, to hopefully adults and children that are undocumented. And the reason why we are pushing for that program is because most of our families are low-income families, are also as we know, undocumented folks do pay taxes, so they are paying into these federal and state-run healthcare systems, and we are just being discriminated against to not being able to access them. And this paired up with the pandemic, as I was said before, it's just catastrophic. We are dealing with life-threatening instances within the community because of the lack of access, because of the lack of healthcare access. So to give you some data, I guess that here in Connecticut, there is a 5% uninsured rate for residents in Connecticut. But comparing it to the approximates of what the data says is that out of that 5%, 54% of undocumented folks are uninsured. So you see the difference in uninsured rates and how that it's definitely deadly, as we're not unable to get them. And the state is already paying for it, right? Like, as I said before, the emergency funds are the ones that are paying for this services that undocumented folks get when they go to the emergency room to get treated for their illnesses, their accidents. Things happen in life, and we the state is paying it in a way that it makes no sense, right? It doesn't. It's just not well, the system where we are working on right now, it's not well prepared for those that are unable to pay. And health is something, it's something that is needed in everyone's life, and it's a human right, as we were talking about it. So I guess the problem that we're having now with that policy and us pushing for this this expansion is that opposition isn't able to provide funds. They're saying that there's no money for undocumented folks and undocumented children, which is crazy to think about, because how do you put a price tag on a person's life, right? How are you able to, we had a public hearing, and there were like about 90 virtual testimonies, and out of those virtual testimonies, we had, like, I believe 30 to 40 people who testify in their native language. And we had different scenarios where women were losing their babies through a miscarriage because they weren't able to afford the prenatal care. We have an instance where a person who in dialysis is unable to get out of the hospital because if he gets out of the hospital, he doesn't know how he'll be able to pay for the dialysis services. And they are basically between in a very difficult spot there. We have well, personally, I have family members that are met with only one option, which is not an option. It's just getting to community centers, community health centers here around the state that are federally funded. And although, yes, that's great that we have access to those, it's very much underfunded, and the physicians or healthcare professionals are underpaid and are overcapacitated. So there is a lack of quality of care there, and that is unacceptable. Where we have a scarce options for when an accident happens or anything like that. But I guess going back to the healthcare policies that are in place is that the system is not made for us, right? The healthcare policies that have been placed are very much money-based, business-based, business, private business, geared towards, and something like as essential as healthcare and wellness shouldn't be a business, right? So that's what Connecticut Students for a Dream is working on right now, and that's what we'll continue to fight until all of us have healthcare that is quality and accessible and for everyone. So, yeah.
Thank you, Katia, for sharing these issues and information surrounding the healthcare issues that are going on for undocumented immigrants. Without these discussions, and courses, we aren't really able to get information out to the public, which is something that, I want to discuss in the next theme of education. So Anne or Grace, I feel like both of you could elaborate on this since you are co-facilitating the Organizing for Immigrant Justice course. Can you explain what you touch on in the classes and that you teach, and how they also benefit the UConn students that are taking them?
So why don't we start with Grace explaining the course Organizing for Immigrant Justice, and maybe Diana, you could even answer how they benefit UConn students, and then I'll jump in after that.
Sounds good to me. So yeah, as Diana said in my introduction, I am a senior and I am minoring in social justice organizing, and it's a fairly new program. I think it's only been around for like 2 years. I'm the first student to complete it. So when it came to the capstone course, it was really just open to me creating whatever I wanted to create. And my advisor connected me to Anne, and we just kind of started bouncing ideas off each other, thinking about what we could do. And we decided to kind of pursue the topic of justice for immigrants. And when we started thinking about the community and how we wanted to really make this not just about an internship experience for me, but something that could benefit the community and students, that's kind of how we came to this idea of doing a 1-credit service learning class. So we work in conjunction primarily with an immigrant rights organization in Hartford, but we also collaborate with other organizations. We've worked with CRD a little bit, and Katia, and we've worked with New Haven. So we focus on a different topic each week in the class. These are topics like sanctuary, ICE, wage theft, mass deportation, the debate between abolition versus reform, and we also talk a lot about radical solidarity throughout all of those topics. So we focus on those. We try to really give people an introduction to a lot of different topics, so that they can be more informed when actually working with the community. And then all the students participate in some type of service, whether that is court accompaniment or translating documents, interpreting at meetings, something that benefits the broader community. And I don't know, Anne, if you want to fill in anything I may have missed, and Diana, if you want to talk about kind of how it has benefited you as a student, I think that would be better than me sharing it.
Yeah, of course. To further elaborate on the points that you made, as a student that's enrolled in both organizing for immigrant justice as well as human rights at the U.S.-Mexican border, I have to admit, like how eye-opening and thought-provoking the course is. Growing up in a Latino household, the experiences I knew about were really only my own and the small communities that were around me. So taking the course, such as these two, really granted me the ability to not only hear about the struggles and determination of others, but also the thoughts of my fellow peers. The world of immigration is not something that comes up in conversation every day, but when you put a group of students together to discuss these sorts of human rights issues, you open up the door to an array of perspectives. Because not only does a course like this really give me a place to feel included and heard, but it gives my peers a safe space to learn about the struggles of the world surrounding them and the ability to walk away out of the classroom with a whole new perspective.
I do want to add on to that and just say too that being a human rights major and still being a student, of course, I think I've learned a lot in all my courses, but I think one thing that tends to be missing is how do I apply what I've learned and how do I take what I've learned now and make change with it. And I think that's what a lot of students are really looking for in classes is I want to know how I can apply my education. And so that was something that Anne and I really wanted to focus on with this class was, okay, so we're learning this, but how can we apply this? It's organizing for immigrant justice, not just learning about immigrant justice. So we hope that all students will feel like they are able to really connect with the community. We've built different resources that give students links to internships or links to other volunteer opportunities. We have our primary partner coming back into our last class to talk about how students can stay involved, connecting them with people in the community, giving them contact information, because we want them to take what they've learned and actually do something with it and continue. And that's going to look different for every student because students are going to be passionate about different areas. Some students might be extremely passionate about court accompaniment work, and other people might be really passionate about working on these healthcare legislation and policies. And it's going to look different, but we want students to feel that they now have the knowledge and are empowered to continue and to continue that engagement and participate in activism related to the topic outside the classroom as well.
Beautifully said. And I'm going to put Katia on the spot in a minute and ask her to talk about how she's been able to apply her Latino and Latin American Studies major out in the real world. Well, you can hear it actually, but but I'd like to get her reflection on that. But one of the things that we try to do in the Latino and Latin American Studies major is make sure that students graduate with at least 3 different experiences in the Latino community or in the research community around Latino issues. And so this is all part of our larger goal of helping students not only learn about Latino and Latin American studies in a framework that is often human rights oriented, migration oriented, thinking about transnational realities and interconnectedness of North and South in the hemisphere. But we try to help students think about and practice, how can I give back to Latino communities? How can I work professionally in Latino communities? How can I really learn the map of what are agencies, workplaces where I can engage with Latin American immigrants, with policy issues. And those policy issues may be about housing or education, labor rights, right? It could be about a whole series of things. 1 in 6 people in Connecticut is Latino, and by 2030, that's going to be 1 in 5. So 1 in 4 K-12 students Latino, 1 in 4 students in community college in Connecticut Latino. One of the things that I'm actually proud of in our program is how we are really helping students think about how can I serve this increasingly important sector of our Connecticut demographics, and fellow neighbors and partners and colleagues and professional collaborators. So Katia, do you want to share with us your thoughts about what life looks like after graduation for a Latino Latin American Studies major, for somebody that is involved in these kinds of classes looking at rights and Latinos?
Yeah. So I guess I want to speak a little bit about the experiences, like those experiences of working with organizations before graduating, and then how I position myself in an organization that worked with the Latinx and undocumented community here in Hartford, well, statewide, but we're mostly focused in Hartford. One of those, as Anne was saying, one of the experiences that I had, actually, I had three unique different experiences. One was with the farm clinics with UConn Health, and that I was one of the coordinators for students to be able to volunteer as interpreters or as in a low capacity working with medical students, dental students, and PA students in different farms around Connecticut. I got to experience, you know, the way that the undocumented community and Latinx here in Connecticut, the farm workers, like work the environment, their stories behind them. I am a firm believer about storytelling and experiencing different things. So it was very important for me to acknowledge and know what their lives are like, how the systems that they are under reflect upon the person. So that was a really incredible experience that I had through the program. Another instance that we kind of shift gears of, like, the environment, the place where I worked with AHEC. I think they changed their name, but the area health equity centers, I believe, and from there we did more of the community education piece of things by letting folks know about what, like, health insurance was, help them to apply to health insurance, get them interested in services that they might need through, like, food banks and church gatherings and things like that. We went to homeless shelters where we did something similar how the farm workers had, but it was a more community-based level where everyone was welcome to go. So you can see the differences between, like, how where they are in the state and how they interact with the the roles that they take up in our society. It was very eye-opening, and also very I was very intrigued in how the different topics and themes I could see from in a broader way, like in broader systems and ideas and backgrounds and information that I had from the class played out in the day-to-day basis. So I think one of the things that I would recommend doing and saying when you're going through these classes is to make sure that you are expanding yourself to different experiences, different settings, so that you're able to, when you are interacting with the line of work of community, service to the community, you're able to have already experienced some of these situations that you might find yourself in. I think it's very important to gear yourself up to understanding that Latinx and undocumented folks are not monolithic. Like, we have different experiences, different ideas, different thoughts around political views as well. So it's very important to understand where people play out, like where they're at in their lives, and once you're working with a community, you're able to navigate that better. Yeah.
Great, thanks. One of the, I'd like to close this section by just asking Grace if she could explain to the audience what accompaniment is. It's one of the primary ways in which we tried to help students be involved in the community and directly serve others in the community.
Yeah, court accompaniment is a practice of basically physically standing in solidarity with someone, whether that be at a deportation hearing or an ICE check-in, or just accompanying someone to a meeting that they need interpretation at, or that they need just someone to stand with them. We would basically go primarily to the court, immigration court in Hartford, and just accompany people through deportation hearings, whether that's an immigration or criminal court. Just, again, as a person, just to kind of stand there in solidarity. We're not there to speak for that person or, you know, get in between any situation. You know, they have their own agency and right to, you know, we're not there to overpower, just really to stand there in solidarity.
Awesome. So Diana, does it make sense to get to our last question about narrative change?
Yes, so, I think our last theme of today's discussion is really something that we have been discussing in the classroom, which is narratives. So this is a question that can really be answered by anybody, but so I just wanted to ask, why is it important to shift the narrative about how undocumented immigrants are seen, and how do the standards of American culture holds about immigrants harm them?
So I guess I can start really quickly, like by just giving a little bit of back concept of what that means. The narratives have very much shifted in where the political view is at. Some things that illegal aliens are very harmful to the economy. Some others, and some that maybe advocate are a little bit progressive, think of them as dreamers. So just giving ourselves some context as to what those narratives or what those things are before we start a conversation is very important. And I think for the work that Connecticut Students for a Dream does, and even within our name, we have the dreamers narrative. We have that conversation about being the good immigrant and the that has to exceed in everything to be able to get access to education, access to healthcare, and that narrative, it's important to shift because how harmful it is to some community members. Some as we all know, we're all human and we all cannot be the best of the best. We all have different circumstances and things like that. So so when we put ourselves and box in ourselves in those narratives, at least for the good immigrant or the dreamer, we are excluding a lot of the population that does not identify as the dreamers. And dreamers are more like the youth, the folks that are more the DACA-mentored folks, and it has been used as a weapon against us in some instances when we want to advocate for expansion of DACA to parents or to the rest of the community. But I just want to start there, and then I can jump in again in another space.
So I also want to sort of back up a step and just talk about why we discuss narratives and narrative change so much in our classes on immigration is that, you know, human rights organizations, international and national in scope, have been really studying hard the idea of narrative change and how it works. How do we convince people to care about asylum seekers at the border? How do we encourage people to want to use U.S. resources to settle refugees and to embrace refugees into their communities? How do we convince people that undocumented workers are providing essential services that we need, and that in return they deserve the dignity of healthcare? That if they're actually paying to clean up a toxic site, that they deserve proper equipment, that they deserve the same amount of money per hour than anyone else down there digging out toxins and bodies, that they deserve to be paid, period, for the work that they've done to contribute to this country. And in these human rights organizations that have been studying narrative change, there are several conclusions that they've come to. And we've seen during the Trump administration, right, as the keynote was just remarking, that the Trump administration was trying hard to change the narrative in the other direction, right, to deliberately stoke anti-immigrant sentiment, to remove "we're a country of immigrants" from the USCIS website, from actually telling Border Patrol folks to use language like illegal alien. And so some of the insights that people learned in studying this is that what's sort of just common sense if you think about it, right? So people just think automatically, they think socially, they think with mental models, right? So you just can't use a rational argument to change people's minds. That you have to understand how socially constructed mental models actually shape our perception and our understanding of reality, and how they guide decision making and behavior. And we know that narratives play a key role in the negotiation of meaning in the political sphere, and that immigrants have been used as a political pawn or ping pong ball, really, in fights between Democrats and Republicans in this country. But because we are learning that narratives are operate as in an emotional as well as at a cognitive level, we have to really think about how to tell powerful stories in compelling ways and revealing ways to sway hearts and minds. And one of the best known examples is Love is Love, that managed to shift the narrative in this country around LGBTQ people's right to marry, and how Love is Love campaign, combined with people coming out to their loved ones, helped really shift the cultural change that ultimately facilitated the policy change. So human rights organizations are now thinking really hard about how do we help create cultural shifts with powerful storytelling. And vocabulary matters, right, as Biden announced this week, right? And this week Biden announced that that Border Patrol and immigration officials working for the government would no longer be using the term illegal alien, that they would be using the term undocumented non-citizens. They would no longer be talking about the need for assimilation, but rather they would be talking about integration. So Biden's people said that words matter and they're important in conferring dignity to those in our custody. Contrast to Trump, right, who in his rallies, it was studied that between 2017 and 19, in his 64 rallies, he used the words alien, criminal, animal, killer, predator, invader repeatedly when talking about immigrants. So there's a big difference in shaping narrative and helping people revert to their worst human impulses versus asking people to be their best selves and to confer dignity and human rights and all those that are in their care, that are in their neighborhoods, and who are actually caring for them, right? As healthcare workers, as disaster workers, as food delivery people, as folks in our food chain, that it's really important that the narrative that we shape that the administration has a large role in shaping, it's important that those narratives shape a culture of dignity and respect rather than a culture of violence and let's go to Walmart in El Paso and shoot 22 people who look Latino, right? How do we really create a culture of dignity and respect and care for all the people that we live with, next to, that we work with, that care for us, and as we care for them.
Well, unfortunately, we're almost all out of time, but I really want to extend a very big thank you to Anne, Grace, and Katia for joining us here today to discuss a very, very important topic that has been surrounding, the US for such a long time. If anyone that is watching would like any more resources, please head to the Human Rights Symposium website, where we will also be uploading the recording of this, as well as some more resources if you're interested. All right, so thank you very much to all three of you for joining us, and I hope you have a wonderful rest of the day.
Thank you.
Are we off?
Trying to stop the recording, but I'm not